I have questions.
I have questions.
I have questions.
I have questions about breastfeeding. Why is breastfeeding a good nutritional choice?
As an infant grows, breast milk changes to meet the baby's nutritional needs. Breastfed babies are less likely to get ear infections, die of sudden infant death syndrome, SIDS, and become obese in childhood. Meanwhile, breastfeeding moms lower their risk of developing hypertension, type 2 diabetes, and cancer. They are also more likely to lose weight gained during pregnancy.
How long should a baby be breastfed?
Any amount of breastfeeding is good for both mom and baby. The American Academy of Pediatrics recommends that infants be exclusively breastfed for the first 6 months. For the following 6 months, continued breastfeeding is recommended along with the introduction of other foods.
Can a breastfeeding mother take medications?
Although many medications do pass into breast milk, most have little or no effect on milk supply or infant well-being. Few medications are not recommended while breastfeeding. Consult with your doctor if you have any questions about specific medications.
Do breastfeeding moms still need birth control?
Yes, breastfeeding can delay the return of normal ovulation and menstrual cycles, but it is not a sure way to prevent pregnancy. Ask your doctor about birth control choices that are okay to use while breastfeeding.
Is it safe for a breastfeeding mother to smoke, drink, or use drugs?
For those who smoke, the best thing they can do for themselves and their baby is to quit. If this or smoking less is not possible, it is still better to breastfeed. Make sure you smoke away from your baby and change your clothes to keep your baby away from the chemicals that smoking leaves behind. As for drinking, the American Academy of Pediatrics recommends waiting at least 2 hours or more before nursing after ingesting alcohol. Meanwhile, drugs such as cocaine, heroin, marijuana, and PCP should never be used because they pose harmful consequences for your baby's development.
What if a breastfeeding mother feels she's not producing enough milk?
Make sure your baby is latched on and positioned well. Breastfeed often and let your baby decide when to end the feeding. Offer both breasts at each feeding. Have your baby stay at the first breast as long as he or she is still sucking and swallowing. Offer the second breast when your baby slows down or stops. Avoid giving your baby formula or cereal in addition to breast milk, especially in the first 6 months of life. Your baby may lose interest in your breast milk and your milk supply will decrease. If you need to supplement your baby's feedings with more milk, try using a spoon, cup, or a dropper filled with pumped breast milk. A human milk bank may also be an option.
What is a human milk bank?
Human milk banks collect, process, screen, and store milk from donors, which is then donated to individuals for whom human milk has been prescribed by licensed healthcare providers. Human milk banks also serve healthy infants who have been adopted or who are not able to get their own mother's milk.
What legal rights do breastfeeding mothers have?
Federal and state laws protect and support breastfeeding in any public or private location. Breastfeeding is also protected at the workplace. Federal law requires employers to support breastfeeding by providing mothers with reasonable break time and a private, non-bathroom space to pump their breast milk for 1 year after a child's birth. Consult with your doctor or a lactation consultant for more about the benefits of breastfeeding. You can also find information on available breastfeeding resources in our area at thewellnesscoalition.org/breastfeeding. Be proud to feed. Be proud to protect your child.